Hello guys, welcome back to the masterclass. We are continuing with high yield multiple choice questions, answers with explanations from the subject applied microbiology and infection control for nursing officer recruitment examinations. This is part 3. You must also watch the previous two videos, part 1 and part 2. So guys, the explanation in this channel is in English. So the biggest benefit for you is you can easily make notes by watching the videos and by reading the transcripts available below video description. So guys, let's start with our high yield MCQs. The question is, which bacterium is the most common cause of food poisoning due to improperly stored food? Options: Clostridium botulinum, Staphylococcus aureus, Salmonella typhi, Vibrio cholerae. And the answer is Staphylococcus aureus. Guys, explanation, once again I tell you, explanations also are the another set of questions and answers. What is the explanation here? Staphylococcus aureus produces heat stable enterotoxins that cause food poisoning. This is also important. Underline this. Heat stable enterotoxins are produced by Staphylococcus aureus, which cause food poisoning. The next question: which bacterium is commonly associated with peptic ulcer disease? Options: E. coli, H. pylori, Helicobacter pylori, Vibrio cholerae, or Clostridium botulinum. The answer is Helicobacter pylori. Check out the explanation here. Helicobacter pylori, or in short H. pylori, is the major cause of chronic gastritis and peptic ulcer disease. Underline this. Next question: which virus causes chickenpox? Options: measles virus, varicella zoster virus, rubella virus, mumps virus. The answer is varicella zoster virus. Check out the explanation here, guys. This is very important. The same varicella zoster virus also causes herpes zoster, also known as shingles, where mostly the upper body part is affected, and another type of herpes is there that is called herpes simplex, where lower part of the body is affected, mostly the genitals are affected. And note one more thing, guys: herpes simplex is more contagious than herpes zoster, but here varicella zoster virus is also responsible for herpes zoster, also called shingles. The next question: which virus causes measles? Options: rubella virus, morbillivirus, mumps virus, and influenza virus. The choice is morbillivirus that causes measles. Guys, look at the explanation here. Very important. Measles is highly contagious and spread by respiratory droplets. Underline this. Next question: which virus causes gastrointestinal tract infections? Options: influenza virus, mumps virus, measles virus, and adenovirus. Check out the explanation here, guys. Adenovirus is the correct option, correct answer from these options. But at the same time, another major virus which is responsible for GI tract infections is rotavirus. So in the options of this type of question, you will find either adenovirus or rotavirus. Normally both will not come in the options. So you have to make a note: both adenovirus and rotavirus, they are responsible for GI tract infections. The next question: mumps virus primarily affects which organ? The answer is salivary glands, especially the parotid glands. Next question, which bacterium causes plague? Options, Bacillus anthracis, Yersinia pestis, Brucella militensis, and Vibrio cholerae. The answer is Yersinia pestis. Look at the explanation, guys. I just remind you, Yersinia pestis is transmitted mainly by flea bites. The vector here is fleas. Flea bites from infected rodents. Guys, the next question, you need to understand the question and answers properly. Which of the following is an opportunistic fungal infection commonly seen, underline, commonly seen in immunocompromised patients? Options, aspergillosis, cryptococcosis, mucormycosis, and candidiasis. The correct answer is candidiasis. And look at the explanation here, guys. All infections mentioned here are opportunistic fungal infections. Opportunistic fungal infections always occur in immunocompromised patient. But what is the question here? Commonly seen. So when the question will be the fungal infection commonly seen in case of immunocompromised patients, you have to mention candidiasis caused by the fungus Candida albicans. Next question, which specimen is preferred for the diagnosis of pulmonary tuberculosis? Urine, sputum, blood, and stool. So naturally the answer is sputum. But look at the explanation here. Sputum is examined here, guys, underline this, by microscopy and molecular tests to confirm tuberculosis. Guys, the next question, which laboratory stain is used to detect fungal elements? Options, Gram stain, potassium hydroxide, or KOH mount. Albert stain, Ziehl-Neelsen stain. The answer is KOH mount, potassium hydroxide mount. Look at the explanation. KOH mount clears the tissue debris available in the sample and helps visualize fungal hyphae and yeast cells. Underline this. Next question. Incubation period is defined as time from infection to appearance of symptoms, duration of treatment, duration of infectivity only, time from diagnosis to recovery. So the answer is the first one. Time from infection to appearance of symptoms. Guys, the next question, which method is most effective for sterilizing culture media? Because many times the culture media also gets contaminated. So the options here, boiling, autoclaving, UV radiation, and filtration. So naturally boiling is not possible. UV radiation also will damage the culture media. Filtration is not applicable. So finally the answer is autoclaving. Autoclaving is the most effective method for sterilizing culture media. Now guys, finally the question, very tricky question. Which of the following is an example of chemical disinfectant? Ethylene oxide, nitrous oxide, glutaraldehyde, isopropyl alcohol. Very tricky question. I'm leaving for your answer. Please answer this question in the comments. Guys, if you like the video, give a thumbs up here and please share your comments. And if you like, please share the video with others. If you have not subscribed to the channel, please subscribe to the channel and stay connected. So guys, stay tuned for the next video. Till then, take very good care of yourself.